bust. That was beautiful, Dr. McIntyre.
Beauty is only epidermis deep, my dear. Just make sure she steers clear of infection. Embers, what antibiotics would you prescribe?
Well, I keep the patient well hydrated and use penicillin, 1 mil Q6H.
Aha, 1 mil. Why not 2?
Oh, yes, why not?
I'm asking you, doctor. Woodruff?
Either go with 2 mil or use 1 mil with another antibiotic.
Very good. Let's get cracking. We got a patient waiting in post-op.
Dr. Christmas, Dr. Jacob Christmas, report to ER staff. Dr. Jake Christmas, please report to ER staff.
JT. Yeah, we got a head injury here. Get him to room 2. Okay. I'll take this other one.
What do you got?
Traffic accident. 2 head injuries. This one's unconscious.
My God, do you know who this is?
You bet I do. Right here, room 4.
I've got stable vitals.
I'm very happy for you.
Wait a minute. Who's the patient here, Mr.
Simmons, Marcus Aurelian Simmons. Been driving now professionally for 37 years and not one accident, not one until...
Well, when you've been driving that long, sooner or later.
Sooner or later, my foot, I wasn't driving. That idiotic old fool I worked for, he was behind the wheel.
Slow down now. You need to relax.
The old slob doesn't even have a license. He hired me so he could borrow mine. He thinks he can get away with anything. If he tries to blame me for this accident...
Sure he won't. I'm sure he won't. Look, Mr. Simmons, you need to calm down. You need to relax. Calm down. How many fingers am I holding up?
Are we including thumbs?
You see more than one thumb?
I see 4 fingers.
How many?
5.
Neurology, a full workup. Make sure that Dr. Christmas sees him. You're going to be okay.
All right, get him prepped for OR. I'm going to go scrub.
Bernie, where's Stan?
He took a couple of hours off. His son is in the school play. He's a chipmunk.
All right, we'll find him and get him here quick.
When Dr. Stanley Riverside's only son is starring as a chipmunk, you just don't...
Ernie, please, find him. His father has been in an accident.
My goodness. Paging Riverside.
Dr. Riverside, please call the operator. Dr. Stanley
Shirley.
Riverside, please call the
Want
operator.
some candy, little girl? As if I need it. Well, maybe you do. Look at me. I'm looking. Why is it the ones who don't need to worry do all the worrying? I shouldn't worry? With your figure, no. Okay, I won't worry. Even trade. Those are the lab tests, right? Mm-hmm. And you haven't told anyone? Are you kidding? It would have been my neck if Dr. Lincoln caught me running these without a billing number. I know, and I appreciate it. My friend appreciates it. He's really broke, huh? Flat out. Caramel Crunch. I hate Caramel Crunch. Can't the folks help her out? She's an orphan, no family. A name like O'Malley and she has no family? Chocolate nuggets. No allergies either. A little anemia. I can't keep doing this, you know. I'm on a diet. I know you look great. Just great.
Yes, he'll be in the VIP suite. And put a couple of nurses on standby just in case. Right.
Evening, Shoot.
Stanley, we've been looking everywhere for you. Where have you been?
Celebrating little Stanley's triumphant debut as an actor. The boy is a bundle of talent, Shoot. He absolutely radiates star quality.
Stanley...
I've never seen a chipmunk portrayed with more sensitivity, more depth.
Yes, Stan, your father...
Well, my father would have been there, but he couldn't. He would have been so proud of little Stanley.
He's here.
Who?
Your father.
My father's here? Why? Why? What did I do?
There was an accident. It wasn't serious. I know he's going to be all right, but...
An accident? My father... Where is he?
He's in surgery.
Oh, my
Jake Christmas
God.
is operating.
Dad. Wait a minute, hold on. This is my father. Wait, Dad. Hold it. No, I gotta see him. Wait, it's not your dad. What?
Your dad's in recovery. He's all right. He's doing fine.
How fine? What happened? What did you do to him?
He and his chauffeur went a cracker.
Simmons.
They got banged around a little bit. Now, your dad had a concussion.
But you had to do surgery.
Just routine stuff. Some scalp lacerations. We did a little repair and some nerve damage in the arm. Nothing major. Stan, you have my word. He's all right. He's strong as an ox.
When can I see him?
He'll be in recovery for a while. He'll probably sleep through the night. Now, why don't you go home?
Home? I can't go home. What if he needs me? I don't want him to know that I wasn't here.
Stan, He's in good hands. He's out of danger. Now go home, get some rest. Come in first thing in the morning and you'll see him. Okay?
You'll tell him I was here.
Of course I will.
He's a sensitive man, my father. I wouldn't want him to think that I wasn't here.
Ginny?
Hi, gang.
Hi, Ginny. All right, everyone. This is Ginny Bass, who's back with us again, a little sooner than expected, I know. You mind if we talk about you?
My life is an open medical chart. The patient is 35 years old. She underwent a left-modified radical mastectomy 2 years ago. A recent mammogram revealed a mass in her right breast.
So our program for now is to reduce Ginny's blood pressure, schedule a biopsy, check her blood count again, and see how her anemia is. Any questions? Okay, onward. Thank you, Ginny. I'll be back.
See you, Jim.
Dr. Woodrow, are you on the reservation?
Yes.
And get off the dime and be on time.
Ouch. My fault. I'm sorry, Jenny.
You look it. Oh, now, will you smile, for Pete's sake?
Hold still.
I'm holding still.
Don't talk. Look, you may be doing this for a joke, but Ida here has a rep for taking a good picture. Got it?
Got it.
Shut up. It's showtime. To your breath. Hold it. Bingo. Huh? Hold that thought. Okay. Done. We're even Steven now, right?
Right. Now put O'Malley down for that, okay?
Why the phony name?
I told you it's for the intern party. We're going to put up a bunch of x-rays and see if we can guess who's who.
Interns. You're bent at the brain. You know that.
Anything wrong? I'll tell you what's wrong. That election there pinches me once more. I'm going to amputate his arm.
Hey, my father.
404.
I know. How is he?
As far as I'm concerned, he's on borrowed time.
Oh.
Not now.
Dad? It's Stanley.
Stanley who?
Dad, stop this now. I'm very concerned about you.
For heaven's sake, Stanley, when are you going to learn? Here I am, close to death, racked with pain, and you won't leave me alone. I'll be a good little boy and get lost.
Well, I just want to make sure you're all right. Are you all right? Dad?
Oh.
Woody, I'm worried about you.
What do you mean?
I think you're taking the surgical rotation too seriously. It's wearing you down. Don't think I haven't noticed.
JT, what are you doing here? You can't read.
Well, things change. I've changed. And I have you to thank for that. No, really, I do. I mean, you were right. For too long, I've been dating girls below my intellectual level.
No, I said they were blithering idiots, not below your level.
You call it the way you see it, you know. I like that about you, Woody. I do really, really. I think that's what friends are for. Woody, I think you're one of my best friends. I'm serious. You mean a lot to me.
Well, likewise.
In times of stress or duress, you know I'm there for you, right?
Yeah?
And you'd be there for me too, right?
Right.
Well, good, because I need you, Woody. I need you now.
I need you too, JT.
Me first. See that librarial assistant over there?
You mean the candy striper?
Yeah, well, whatever. Anyway, so far all there's been between us is like, hi, hello, you know, how are you? All the basics, right? Well, I'm about to make the big move, but I want it to work this time. So I thought maybe you could do a little research for me.
Research?
Yeah, you know, talk to her, get some background, a few facts and figures.
You play detective?
Sort of.
And Cupid?
Well...
Sorry, I'm busy.
No problem. So, what are you working on? What's this?
Hey!
Oh, that's all right. O'Malley. Is that a he or a she?
She, but you wouldn't be interested.
Sure I would. Is there some problem? Is there some trouble?
Dr. J.T. McIntyre, please report to room 312, stat.
312, that's Simmons.
Dr. J.T. McIntyre, please report to room 312, stat.
Jake, what happened?
Trip to the loo proved dangerous.
I found him on the floor.
Yeah, lucky for you. Thought a professional chauffeur could navigate better than that.
Without curb feelers, I'm lost.
What about the CAT scan?
Didn't post a warning. Gonna have to run a new series.
Pulse is 30. Pressure's 90/60.
You got room in ICU, Arnie?
Whenever you're ready.
Let's go.
Woody, there you are. I have to do some fast talking. Dad was looking for you. I told him you were bailing me out. Come on, Woody, hustle up. I only bought you 10 minutes.
Yeah, okay, thanks, I'm going.
Whoa, wait. What do you got here? O'Malley, you're still stuck on this one?
All right, hotshot, what's your diagnosis?
Mediastinal widening. Probably from enlarged lymph nodes. Well, I'd have to know more. What other symptoms are there?
Low-grade fever, fatigue, malaise.
Any of the lymph nodes?
Enlarged in the neck, thank you.
You know, we could be looking at Hodgkin's disease here.
You sure?
What tests have you run so far?
Said rate elevated, mild anemia, but the chest x-ray says it all.
Yeah, Hodgkin's. Woody, this O'Malley, is she a friend of yours?
Yeah, we're close.
Woody, what's going on?
Nothing.
Wait a minute, tell me. I want to know. What is going on? Who is this O'Malley? Answer me.
Me.
What?
Me, I'm O'Malley. Me, Hodgkin's and all.
Oh, come on, cut it out.
You think I'd kid about something like this? Do you?
Day in my life, till now, I never realized what I was missing.
Missing?
Well, think about it. A sick man, if he handles it right, can have almost anything he wants. Friends, strangers, people in general, well, become more solicitous, more caring.
Like Tammy and Barbie.
Exactly. So I think I'll stay here and enjoy myself, my misery for a while.
Well, I don't think that's going to be possible, sir. I'm planning on discharging you in a couple days.
Well, you better change your plans because I'm staying.
Mr. Riverside, as you're well aware, this hospital is overcrowded. We're going to need this bed.
Young man, you're talking to the chairman of the board of this hospital.
No, sir. I'm talking to a patient who's well on his way to recovery. You're leaving Friday.
Now, wait a minute.
And to avoid any unforeseen setbacks, no more visitors.
Hold on, Buster. You can't...
Friday.
Jenkins needs blood gases, and I think you should look in on Jenny Bass. Her hematocrit is down. I mean, we discussed the options, but I really think we need to move on with the biopsy.
Right.
You know, better yet. Look, why don't you go to this fundraiser, and I'll finish rounds.
Ah, but it's you they want to see.
Don't you believe it? Okay, what's this?
O'Malley, the case I've been helping JT with, we could use your input.
Uh-huh. You do any skin tests?
TB and fungal, all negative.
Okay, let's see the picture. Could be serious. Marked lymphadenopathy. Is this patient in the hospital yet?
No.
Now, look, let's get her in here and work her up so we can start treatment.
Right. So you'd say it's lymphoma?
Well, it sure looks like it. Let's check it out.
Well, thanks for your help, Dr. McIntyre.
No problem. Well, I'm off to the rubber chicken circuit.
Doctor, I can assure you that everything feels tip-top below the neck. If you could run a little brandy through these tubes, it might help to anesthetize this headache.
Well, that's a plan, but I think my associate and I have come up with a better one. That knock on your head looks like it bruised some brain tissue, possibly a cerebral contusion. Doctor, do you want to tell Mr. Simmons what we'd like to do?
Sure. Yeah, we'd like to put you on a new medication. It's a combination steroids, IV fluids.
Oh, sounds delightful.
Well, it'll work. It'll make you feel better. What it does is it reduces the swelling on the brain. By the way, do you have any family we can contact? I don't have anything down here.
There must be somebody.
Only that weasel-hearted employer of mine, and he couldn't care less.
Ah, well, how about our new plan? What do you say we give it a try?
Green light. Drive.
Drive.
Drive. Right.
There's something you're not telling me.
What? No, Ginny.
And you're not getting enough sleep. Or loving.
Or both. I'm an intern. Neither is part of the program. You're doing fine. Don't worry about anything.
It's funny. This time around, I'm more angry than worried. Angry at me.
Why?
You know and I know all of this could have been prevented from the beginning.
Ginny.
No, don't try and patronize me. We have a pact, remember? 2 years ago, I lost a breast because I never went in for an x-ray. A physical. Did I watch my diet? No. Did I put down the smokes? No. I was too busy making promises I never kept.
What kind of promises?
Well, I promised myself I'd go ballooning over France, rafting on the Rogue River, windjamming on the Caribbean. I promised myself I'd quit my job, buy a van, and visit every relative on my family tree.
You can still do it, you know.
Every time I get started, I seem to end up in a place like this. Complaining about not getting started.
Look, you'll be out of here soon.
That's why I admire you, Woody. You knew what you wanted, and you didn't wait. You went out and you got it.
You sure you got the right girl?
You wanted to be a doctor, right? Well, here you are. You worked hard for it. You earned it. Now you've got it all.
Yeah, well, not all.
Cherish it, kiddo. Savor it. Enjoy it. Don't let anything get in the way of that. You hear me?
Yeah, Ginny. I hear you.
Okay.
Woody?
Oh, great, I could use an assist. You need a lamp? You can borrow this one. Bound to disappear if I move it to the intern's quarters.
You're moving all this stuff in there?
To your locker, to be more precise. You don't need it, you got the Titanic, right?
You're selling your car?
What do you know? He can read. Yes, I'm selling my car. Why, are you interested?
What are you, nuts? This is your baby, your child. How many girls do you know love their car enough to change their own plugs and oil? This car's gorgeous.
Well, she ought to fetch a good price.
You act like you're closing the books.
Come on, JT, I can read the writing on the wall. Now, come hell or high water, I'm going to finish my internship and my surgical residency. After that, I have other things to consider, like my parents and all the money they forked out for my medical education. I can't keep draining them. What's the point?
What's the point in talking terminal? Hodgkin's is treatable if it's Hodgkin's at all.
It is.
Nothing's set, nothing's certain. You need a tissue diagnosis.
I asked your father for a second opinion. He gave it. It's lymphoma. And I also told him the patient's name is O'Malley, and we're going to keep it that way, right? JT, I want your word on that.
All right. What about the biopsy? You can't start treatment until you confirm.
I know, I'll take care of it.
When?
After my rotation.
Damn it, Woody. You know you can beat this thing. I'm sorry, it's just that when I think about what you're going through,
My dear, you've always had a flair for the dramatic.
Woody, I feel awful.
I know it's difficult, but try to remember one thing. I'm the one who's sick, not you.
This is on call to CCU staff. Pharmacist on call to CCU.
Hello there, may I come in?
Who is it?
Stanley.
No.
Dad, please, I have good news for you. Are you alone? Is he alone?
He's alone.
You're alone. I'm coming in. Wonderful news, Dad. I talked to Dr. Christmas a few minutes ago, and Dad, what is it? What's wrong?
I'm dying, Stanley.
Dying? No. Normal pulse, no fever. No, Dr. Christmas says you're in great shape. He's going to discharge you on Friday.
I'll be dead by then.
Stop talking that way. What is it? What's wrong? Why are you feeling this way?
I had this dream, this vision. I was lying on the operating table the other day, and I saw this great white light.
That's the operating room light. It's about this big, very bright.
Whose vision is this, yours or mine? The light was blinding, all-encompassing, and warm and welcoming. I saw myself leave my body and drift upward into the light, like a moth to a flame. I saw myself from a great height.
Dad, for heaven's sake, listen, I checked all your medical reports.
There's a greater truth in medicine, my son. I saw it, I sensed it, I felt it. I know my time has come. Stay with me, my boy, please.
Of course I'll stay with you.
It's so good, so comforting to know you're here when I need you.
You need me? Really?
More than anyone. Over there on that nightstand.
Yes.
There's a telephone number.
Yes. Yes, I have it here.
Yes, that's it. Thanks. Will you call that number, please?
Yes.
Tell Bambi I must see her today, tonight.
Bambi?
Well, you gonna deny a dying man his last request? Thank you, my boy. She may even have a friend for you.
Hello. May I please speak to Bambi?
Uh-huh. Yeah. Yeah. No, Mom, I wouldn't even miss that apartment. It was a rip-off anyway. Besides, you should see the accommodations they gave me. Incredible. Yeah, it was a lucky break, all right. What? Lizzie's getting married? Her maid of honor? Well, when's the wedding? Next summer, huh? Wonderful. You bet. Plan on it. I'll be there with bows on. Tired? No. Well, yeah, maybe a little. These surgical rounds have really kept me hopping. Listen, I'm sorry I've been so out of touch. There's no excuse. You're only 20 minutes away. Well, I miss you guys. Yes, I really do. Listen, why don't we get together? You're going out of town? For how long? Really? No, that's all right, Mom. We got lots of time. Well, love to Dad. I love you too.
Woody, wake up.
What time is it?
10:15.
Thanks. Ugh. Gotta take my makeup off, cardinal rule.
Woody, it's 10:15 in the morning.
What? Oh, no. I missed morning rounds.
Yeah, I know. I covered for you.
Oh, thank you, thank you, thank you.
Don't think I'll let you off the hook. Now be prepared for the wrath of Dad.
Oh, no.
Coffee? You know, it might soften the blow if you tell him the truth.
JT.
All right, all right. I was wondering why nothing showed up on our physical. That was 2 months ago.
Because I didn't take my physical. No time. I had ER rotation.
Then it's been about a year since you had your last one?
Something like that.
Woody, you better get a hold on this. You know this kind of thing can run away on you, and then what?
JT.
Aren't you ignoring some very important things, like your breathing and your voice? What about this rash? I know you're a stickler for hygiene, so don't tell me...
JT, I only asked you to do me one favor, and that's keep your mouth shut, okay?
Where have you been?
I'm sorry, there was a crisis, so I...
What do you think we have here? Look at him. He went into a coma a half hour ago.
Medication?
It's not working, obviously. So where are we? Excuse me, I hope I'm not interrupting some sort of Vulcan mind meld here.
I'm sorry.
JT, this is the intern's opportunity to show me up. He did the last workup. Where would you go from here?
Okay, I think we're looking at a cerebral contusion. Maybe an AV malformation. I'd run another CT scan, and, what the heck, while we're at it, why not run an angiogram?
Tell me what?
What choice do we have? This route's obviously taking us nowhere, and we have to have an answer now.
Now you're talking. Go set it up.
Hi, John.
Oh, Stan.
Busy?
As a matter of fact, I was just going for lunch. You want to join me?
No, thanks. Another time.
Something wrong?
No, everything's fine.
I'm sorry I haven't had a chance to look in on your father today. How's he doing?
He's dying.
What?
Well, he thinks he's dying. He's convinced of it.
Yeah, Jake said he's doing very well.
Well, he is, I guess. See, dying is very expedient for my father right now. It helps him to get everything he wants.
Already gets everything he wants.
No, but he wants more. See, he always wants more, and he'll say anything, he'll do anything to control me. Control you, control the world.
And, of course, you keep pandering to his little scam, huh?
John, he's my father. What else can I do?
Come on, Stan, you're a father, too. Would you want your son to act the way you're acting?
My father and I have a slightly different relationship.
Then change it.
How?
Stand up to him. Call his bluff.
John, after all these years, that's not so easy.
Hey, nobody ever said it was... Oh, never mind. Ahoy, the Titanic! I'm looking for a lunch partner. You interested?
No thanks, Dad. I'm not hungry.
What? Wait a minute. I don't believe it. Did I hear you just say that you are not hungry?
Some other time, okay?
Come on, out with it. You never turn down food, especially a free meal. What's the matter? Something wrong with your gut?
Yeah. I'm just sitting here wondering which is worse, lying or covering up for someone else.
Oh, yeah, well, I can see how that would interfere with your appetite.
Dad, there's this patient, O'Malley. Woodruff showed you her x-rays?
Oh, yeah, the Hodgkin's disease, right? I told Woodruff to admit her. Is she here?
Yeah, she's here. She's been here all the time. Dad, O'Malley is Woodruff.
What?
I'm betraying a confidence by telling you this.
Certainly not a friendship. Why is she covering up?
Well, think about it. Everything she's worked for, surgery or internship, she's afraid she'll lose it all if she takes up bed space. We're so close to the end of the term, she figures she'll just deal with it later.
Silly, she's not thinking straight. This kind of cancer has a mind of its own. Look, you want me to talk to her?
Okay, but do me a favor. Don't let on that I told you. Be clever. Tell her you beat it out of me.
Where the hell is the lab report?
Give them a little time, Trapper. It's on its way.
Okay. You may have noticed that I took a wider margin around the lesion. And anybody care to tell me why? Woodruff?
Ginny's mammogram showed some satellite lesions.
Dr. McIntyre, I have the results.
All right, Shirley, what do we got?
The frozen section showed a carcinoma infiltrating.
Damn. All right, let's go ahead with the mastectomy. I need retraction. Doctor, are you with us, Woodruff? Step aside, please. Ambers, retraction.
Yes, doctor.
Come on, let's go. There'll be a post-op consult in 20 minutes. Dr. Woodruff? Moment, please.
Dr. McIntyre, listen, I'm sorry, no excuses. I just lost it.
Wasn't pretty, was it?
35. Ginny's only 35. 2 breasts gone to cancer in 2 years. God, it just isn't fair.
Well, it's never fair, but it can't be treated. Anyway, I'm not here to talk about Ginny Bass. I want to talk about O'Malley.
JT, he told you, didn't he? I knew he couldn't keep his mouth shut.
It's okay. I'm glad he did. However, I want to know what you're going to do about it.
Well, first I'm going to finish my surgical rotation, and then I'll admit myself for tests and a biopsy.
Forget about the rotation. I want to check you in here now, today.
Wait a second.
I can't afford to wait, Doctor. Use your head.
I know the risks, and I don't need the lecture, okay?
Okay. No lecture. You're off the rotation.
No, Dr. McIntyre, you don't understand. Look, I see people come in here all the time, like Ginny Bass. They fight it. It comes back. We cut it out. It still comes back. If that's what I'm in for, look, it all boils down to one thing: time. Doing the most with the time I have left.
That's exactly what I'm trying to give you. Time. Lots of time.
I'm scared.
Of course you're scared. But don't knock it. It might keep you rational.
Yeah. You know a good doctor?
Come on, let's get your room.
With a view?
And with a prep for a biopsy, say, 9?
Make it 8. I'm an early riser.
Dr. Peel, please call your office.
Dad?
Bambi.
It's Stanley, Dad.
Call Bambi before it's too late.
No, Dad, we have to talk. Now, please, listen to me.
Oh, go away, Stanley.
Dad, I feel that it's time that that we came to some sort of understanding.
You're in the will. What else do you want?
A chance to talk to you.
You talk too much.
But you never listen. If you just listen a little, maybe you'd come to know me better, and maybe you'd even learn to like me a little more.
Don't be ridiculous. Get lost, Stanley. Let your poor, pain-racked father die in peace. Are you calling Bambi?
I'm calling your attorney to settle your estate.
My estate?
You're dying, remember?
Well, that might take a little time.
Rapid physical deterioration. There must be mental deterioration as well. I'm going to have you declared mentally incompetent.
Are you crazy calling me crazy?
Hello, Armbruster, Galloway, and Gaines.
Put that phone down.
Aha!
Nothing. Put the phone down.
There. Now that I've snatched you out of the jaws of death...
Don't get smart.
I would like to take this opportunity to tell you that I think that you are nothing but a useless, good-for-nothing fraud.
I beg your pardon?
You're a fraud, Dad, a phony.
Listen, Junior, have you forgotten you're talking to your father?
No, you're not my father. You're a fake. A real father doesn't humiliate and belittle his son. A real father treats his son with respect and love. Love. You know the meaning of the word, Dad? A real father is motivated by love, not by some stupid, oversized ego.
Stanley, do you realize what you're saying?
Yes. I'm saying what I've been afraid to say all my life. All my life I have thought of you as this big, powerful, overwhelming, frightening creature. And now all of a sudden I see you for what you really are. And you're not frightening anymore, Dad. And you're not big, and you're not powerful. You're nothing but a selfish, arrogant, insufferable little man.
Stanley, my boy, I think I've underestimated you.
Get dressed. We need the bed.
Suction?
Yes, thank you. Hang in there, Mr. Simmons. Your headache will soon be over.
I hope so.
These head injuries are tricky. Start out assuming you're dealing with a severe concussion, and it's what do you know, folks.
After all his tests, I never expected a subdural.
All right. Sponge. Have some cottonoids ready, please. Let me tell you a little story, JT. When my daughter Lindsay was 2 years old, Emily and I bought a new car. One of those expensive foreign jobs. It was a great ride. Nice plush interior.
Nice.
Yeah. One day we decided to take a spin in it. Bulldog plan.
Suction.
Mm-hmm. And Lindsay was potty training at the time. Each of us assumed the other had taken her before we'd left. So we were out on the open road, and you can guess what happened. See the moral of the story, JT?
Never assume anything or you'll wind up with dirty upholstery?
I see greatness in your future. Clamp.
Hey, JT, want to get a sandwich?
Not now, sorry.
Hey, man, you gotta eat.
Doctor, here's the rest of the material you asked for.
Great, great.
Uh-huh. I marked the appropriate sections for you.
Thanks.
So what is it that you're looking for?
I'm not sure. You're in my light.
Oh.
Symptoms. Where are the symptoms?
Doctor, you're showing a great deal of stress.
Stress? No, that's not one of the symptoms.
Well, it's certainly not good. But there are ways to relieve it.
Elevated white count?
I get off in an hour.
Yeah. Yeah. Wait a minute.
Where'd you find it?
I think so.
Good, because I could use a ride home. Okay?
Yeah. Good. Great. Thanks. See you later.
What? Wait.
Dad!
Later.
No, Dad, I gotta talk to you.
I can't. I got a racquetball game in 10 minutes.
It's about O'Malley.
O'Malley?
Oh, Woodruff. She doesn't have Hodgkin's.
How do you know?
The x-rays. We banked everything on the x-rays. But what about her other symptoms? Woody's high calcium level? The rash on her neck? Pop, that's no rash. It's a lesion. Dad, I'm brilliant. Woodruff doesn't have Hodgkin's. She's got...
Sarcoidosis.
Sarcoidosis.
Lofgren syndrome. Emulates lymphoma to a T.
How'd you know that?
Ask Woodruff. You are brilliant.
It's simple, stupid. We took a lymph node biopsy.
When did you do that?
While you were in surgery.
Oh, that's great. I'm in there saving Mr. Simmons' life. You turn into a normal person.
Almost normal.
Woody, you're going to be okay. I got a treatment plan. This sarcoidosis can be cleared up and contained. If you don't believe me, ask my dad.
I did. And your treatment better work fast, Doc. Your father expects me back on his rotation by the end of the week.
You think he cares that much?
Absolutely. Your father loves and respects me.
Ha! You're assuming too much.
That's bad?
It's not good. Take, for example, that candy striper in the library. I assume that she hardly knew me. The fact is, she has the hots for me.
The hots? Talk about assuming too much.
She's crazy about me.
You want a second opinion?
I'm serious.
JT, she's toying with you.
That's okay. I like toying. Toying is nice. Do me a favor, will you? When you get a chance, will you find out a little bit about her? Please, a few salient facts.